Opposite sides of the aisle and the issue. What did they think of the president's TV appearance last night, and how would they fix the system? Lamar Alexander is a Republican senator from Tennessee. He serves on the Senate Appropriations Committee, and Senator Kent Conrad is a Democrat from North Dakota. He's the chairman of the Budget Committee. First off, nice to see you both standing next to each other. We do appreciate you coming on the show and being here together. Let me begin with you, Senator Alexander. Do you think the president changed any minds last night?
Well, he always does a good job. I think maybe he changed his mind last night. He didn't talk very much about getting it done quicker than we have time to read the bill. He talked more about cost, which is where he ought to be, because the bills that we have now flunk that test. We ought to be trying to make sure Americans can afford their health care insurance, and then, as Senator Conrad has really been a leader on, to make sure that when we're finished, they can afford the government.
And so, Senator Conrad, what do you have to say about that? Do you think he made some progress, or do you think he muddied the waters a bit last night?
No, I thought he made progress, and I thought he sounded just the right notes. That it is, just as Lamar indicated, it is absolutely critical that we get a hold of this cost explosion. We are spending twice as much per person as any other country in the world on health care. And, you know, we have excellent health care in this country, but on many metrics, we're pretty far down the list in terms of overall performance. But this cost explosion simply must be contained. We're spending $1 in every $6 in this economy on health care. On the current trend line, we will spend $1 in every $3 in this economy on health care. That's totally unsustainable.
In fact, a Congressional Budget Office report, I'm sure you're very familiar with it, it's been in the media now for a couple of days, said that the House Democrats' plan would cost $1 trillion over 10 years and then actually increase the deficit, which is also a big issue, by about $65 billion over the same amount of time. You both hold these key positions on committees that we mentioned. You control the purse strings. How concerned are you, Senator Alexander?
Well, I'm very concerned about it, but I'm not the only one. I mean, the Mayo Clinic last Friday said we're headed in the wrong direction. The Democratic governors are up in arms over the shift of cost to states of Medicaid that's going to raise state taxes. As you said, the Congressional Budget Office has said we're adding to the deficit. The president has said no addition to the deficit. He said we don't want you to lose your insurance, and the legislation we've seen so far does both. So I'd say if it were a baseball game, we're kind of at the bottom of the first inning. We need to keep working and try to focus on cost.
Yeah, and baseball games are usually pretty long. Senator Conrad, your thoughts?
This is a case where Senator Alexander and I entirely agree. Look, we have got to do a better job. At the end of the day, we are going to be judged in history on whether or not we get this right. Getting it right, to me, means, number one, having it fully paid for over 10 years, reducing the cost curve beyond that so that we don't have these continuing explosion of premiums for our families, making our businesses less competitive, and really putting the government itself at risk, because not even the government has deep enough pockets to be able to explode, to be able to afford these exploding health care costs.
The president is in your party. You have the majority. Is it going to pass, Senator Conrad?
Well, first of all, we got to get it right. We will reserve judgment. I think it's very important we take this on, but
you don't know.
Taking it on, we got to get it right.
Yeah, you don't know. All right, well, to the both of you, we appreciate your time very much. Senator Lamar Alexander and Senator Kent Conrad, unfortunately. Senator?
Yeah.
Oh, forgive me. Okay, I thought Senator Alexander was trying to say one more thing. Want to make sure we give equal time to everybody.
I'll be glad to say one more thing.
Sadly, we are out of time. Will you come back? We'd love to have you again next time around. How about that? All right, bookers have booked it. Thanks so much, gentlemen. We appreciate the time. Did anything